What are genital herpes? Now, genital herpes is a sexually transmitted infection caused by the herpes simplex virus. It's one of the most common STIs worldwide and can affect both men and women. Genital herpes is typically transmitted through sexual contact. That can include vaginal, anal, or oral sex, as well as through skin-to-skin contact with any infected area. Here are some key points about genital herpes. There are two types of herpes: herpes simplex viral, which are HSV1, and HSV2. While HSV1 is commonly associated with oral herpes, such as cold sores, it can also cause genital herpes through oral genital contact. HSV2 is the primary cause of genital herpes and is usually transmitted through sexual activity. What are the symptoms like? Now, many people infected with genital herpes may not exhibit any symptoms or have mild symptoms that go unnoticed. However, common symptoms include the appearance of small, painful blisters or sores around the genital buttocks or anus. These blisters can break open, resulting in ulcers that can take a few weeks to heal. Other symptoms include itching, tingling, or a burning sensation in the affected area, swollen lymph nodes, and flu-like symptoms such as fever and body aches. Now, you can get recurrent outbreaks. After the initial infection, the virus remains in the body and can reactivate periodically. These recurrent outbreaks are usually less severe and shorter in duration than the initial period. Outbreaks may be triggered by various factors such as stress, illness, hormonal changes, or a weakened immune system. Diagnosis. Genital herpes is typically diagnosed through a physical examination and laboratory tests such as viral culture or polymerase chain reaction (PCR) test. Blood tests can also detect antibodies to HVS, indicating previous exposure to the virus. Treatment. These medications such as acyclovir, valcyclovir, and famciclovir can also lower the risk of transmitting the virus to sexual partners. It's important to start treatment as soon as possible during an outbreak to maximize its effectiveness. Transmission and prevention. Genital herpes can be transmitted through sexual contact, even when there are no visible symptoms. The use of condoms and dental dams can reduce the risk, but does not eliminate it entirely, as the virus can be present in areas not covered by the barrier. But what about the impact of having genital herpes? Because I see this in my clinic a lot. It can cause an emotional and psychological impact for those affected, because being diagnosed can mean that there's a lot of shame around it, there's guilt and anxiety. I've known patients who feel really depressed by it. But it's essential to seek support from your healthcare provider very early on if you're experiencing any of the symptoms. Pregnancy and childbirth with genital herpes. Pregnant women with genital herpes can transmit the virus to their baby during childbirth, which on the whole might not be that serious, but can also lead to serious complications. However, with proper medical management, the risk of transmission can be significantly reduced. Women with a history of genital herpes should inform their midwife or their gynecologist very early on to develop a plan to minimize the risk to the baby. We're very good at managing this now. It's important to note that the overall view of genital herpes and the management is very, very important, and then you ask the healthcare provider the diagnosis and also getting tested to make sure that it's right. This is a really common question that I get asked. Does genital herpes go away with menopause? Genital herpes does not go away after menopause. Menopause is a natural stage in a woman's life when her menstrual periods are no longer, usually 1 year without a period, and she's no longer ovulating. However, menopause does not eliminate or cure the herpes virus if a person is already infected. It's important to know that once a person contracts herpes virus simplex, it remains in the body for life. So during menopause, hormonal changes, it can affect the frequency and the severity of the herpes outbreak. Some women may experience fewer outbreaks, while others may find that their outbreaks remain the same or they can increase. It's important to know that even if a woman does not have any experience of visible symptoms or outbreaks during menopause, she can still transmit the virus to her sexual partners or their sexual partners. Asymptomatic shedding, which refers to the release of the egg without any visible symptoms, can still occur. So using contraceptive is really important, even in the menopause, postmenopausal phase, as barrier methods to prevent transmission. So if you have genital herpes and are going through menopause, it is essential to continue practicing safe sex and continue necessary precautions to prevent transmission, such as using condoms and having antiviral medication as prescribed by your doctor or your nurse. Try and get a regular communication with your doctor, especially if you're experiencing herpes outbreaks during menopause.